So, good afternoon, everyone. It's a pleasure to welcome you all to our public awareness program, Expert Talk on the Management of MASH or MESL. So, our aim is to provide top-notch education and awareness about fatty liver disease to our healthcare professionals, their families, and patients. So today we are honored to have Dr. Dhruv Mishra, as a renowned gastroenterologist from Delhi, as a speaker. So with over 7 years of experience in the field, Sir is known to provide exceptional care to his patients for treating various gastrointestinal disorders. His commitment to patient-centered care and spreading awareness about MASLD is truly commendable. So we are very grateful for his dedication to improving liver health and educating others about this such important topic. So without further delay, I would like to invite Dr. Dhruv to share his valuable insights on management of MASH and MASL. Over to you, sir.
Hello, ma'am. Thank you so much for that kind introduction. And I think we'll start with the talk right away. We'll be talking today about the management of MASLD and MASH in brief. MASLD, as we all know, is metabolic associated steatotic liver disease, and MASH is metabolic associated steatohepatitis. So we start with the very basics. What does the liver exactly do? The liver is the second largest organ of the human body in the upper right portion of the abdominal cavity. And it is pinkish brown in color with a soft consistency and is highly vascular, which means it's sponge-like and has a lot of blood vessels. It serves innumerable functions. It processes nutrients, destroys RBCs, it detoxes our blood, breaks down all our alcohol and medication. It produces some proteins, it produces some amount of good cholesterol, bile, and it controls around 500 metabolic processes. So, non-alcoholic fatty liver disease, which is now called MASLD, metabolic dysfunction associated steatotic liver disease, is a condition in which fat makes up more than 5% of the weight of the liver. And this increase in fat should not be caused by alcohol use. Left untreated, this progresses to MASH, which is metabolic dysfunction associated steatohepatitis, which means that fibrosis or hardening of the liver has set in. Being overweight or obese, having diabetes or high cholesterol are all associated with an increased risk of MASLD. Prevalence. So India traditionally was not an area which was very highly prevalent in MASLD, but with recent trends, with change in our diet, with change in our lifestyle, with a more Western diet, the prevalence has increased significantly to a point where Asia has an average prevalence of 27%, which is quite high considering the amount of people that stay in Asia. And why is MASLD such a problem? Because it progresses from a healthy liver into a fatty liver, into a fibrotic liver, which is a hard liver, and finally into a cirrhotic liver, which is shrunken. And this liver, a cirrhotic liver, is unable to work properly. What is the difference between MASLD and MASH? MASLD is just simple accumulation of fat in the liver, whereas MASH is fat plus inflammation and scarring. Once scarring sets in, fibrosis sets in, then it becomes irreversible. There is a large degree that we cannot reverse even with lifestyle and medication. Some common causes of MASLD include obesity, genetics, unhealthy food intake, metabolic syndrome, certain medications, and physical inactivity. So being overweight or obese causes fat to accumulate in the liver. This increases the amount of fat to constitute 5 to 10% of the total body fat, and this leads to MASH and scarring of the liver. The association between diabetes, we are the diabetes capital of the world, India, and the association between MASLD and diabetes is striking because it is bidirectional. Diabetes increases the risk of fatty liver, and fatty liver in turn increases the risk for diabetes. So there is a threefold, 3 times more increased risk of death due to cirrhosis in patients who have MASH or MASLD. And again, those who have MASLD have a 2 to 4-fold increased risk of developing diabetes. What are the symptoms of a fatty liver? So most people do not have any symptoms, but those who do have very non-specific symptoms such as mild fatigue or discomfort or pain in the right upper abdomen. When it progresses, it can lead to more severe symptoms such as nausea, fluid buildup in the abdomen, confusion, a decrease or loss of appetite, easy bruising, swelling of the feet, unexplained weight loss, jaundice, and even varices, which is the formation of dilated blood vessels in your food pipe. Fatty liver is now considered a silent killer because the progression of the disease is very gradual. But make no mistake, at some point of time, it will harm your liver, it will scar your liver, and then it is all downhill from therefore onwards. The diagnosis of MASLD often involves the following. There are some blood tests. There is an ultrasound or a test called fibroscan. In some cases, we need a liver biopsy and sometimes an X-ray, CT, or MRI. Most commonly, the tests used to diagnose fatty liver are called SGPT or SGOT, also known as ALT, AST on your liver function test. These are some parts of the 10, 12 parameters that we see in a LFT, liver function test. So persistently elevated ALT can be associated with disease progression, but patients with normal ALT can also develop progressive disease. Up to 80% of patients with fatty liver can have a normal ALT, and no designated ALT cutoff for prediction of MASH or advanced cirrhosis is present in MASLD patients. There are some scoring systems also, such as the FIB4 or the NAFLD fibrosis score. These scoring systems have been used to establish and more better than the ALT, AST alone. They are more sensitive, they are more useful, and they can be done bedside. Online tools are also available to calculate these scores. You can just enter the values and generate the report. So when we talk of diagnosis, the non-invasive diagnosis is through ultrasound because it is easily available, economic, and it is the reason for the most accidental diagnosis of MSLD. Patient goes in for another diagnosis for another reason, and incidentally, fatty liver is caught up. But an ultrasound only detects fat if fat is more than 25%. Also, it cannot differentiate between fat and fibrosis. Another beautiful test is the transient elastography, also known colloquially as the fibroscan, which can diagnose fat with a fat percentage of more than 10%. It can differentiate between fat and fibrosis both, and it is very easy to operate. However, in very obese patients, it can have incorrect values. Lastly, we have something called an MRI proton density fat fraction PDFF, which is technically the gold standard, and it can measure fat content even when it is more than 1%. And it is widely used technique for liver donor patients, in patients who are being worked up to donate their livers. But it is costly and it is not easily available. Liver biopsy, again, it is a gold standard method for diagnosing fatty liver, and it is the only method currently to diagnose MASH. We cannot diagnose MASH technically without a liver biopsy. It can also be used to rule out other causes of a fatty liver. But it is painful, it is individual dependent, sorry, and chances of misdiagnosis are possible if the fatty liver is in its very early stages. Progression takes years. So we have time, we have certain time windows, and early intervention will always be beneficial. When we talk about management, it is multimodal because it includes diet, exercise, lifestyle modifications, and some new medications also. So, most importantly, your diet and lifestyle, which includes controlling your weight. So, a combination of hypocaloric diet, which means that the amount of calories we eat in total should be low, along with a moderate intensity exercise, provides the best likelihood of sustained weight loss. Weight loss of at least 3 to 5% body weight helps to improve steatosis, and weight loss of 7 to 10% improves the majority of histopathological features of NASH, which means that if you can lose somewhere between 10 to 12 kgs weight, not only will the fat go down, the fibrosis, the hardening of the liver will also improve. So, with a weight loss of 10%, we can reverse fibrosis by approximately 50 or 45%, which means the liver can again become soft and supple. With weight loss of around 7%, we can have resolution of the inflammation. With weight loss of 5%, large majority of the inflammation can go down. And with a very insignificant weight loss, that is around 3%, the steatosis, at least the fat in the liver will go down, even if the fibrosis does not. What is the recommended diet for somebody with a fatty liver? So this is also called as the Mediterranean diet. So moderate portions of poultry, eggs, cheese, and yogurt. And every day, all meals should be based around vegetables, fruits, whole wheat grains, olive oils, beans, nuts, legumes, seeds, herbs, and spices. What is to be avoided is red meat and sweets. And you can have some fish, some seafood once or twice a week. What are the types of exercises that we can do? So it is divided into two. There are the aerobic exercises and resistance exercises. Aerobic exercises reduce liver fat, maintain healthy weight, and improve our cardiovascular functioning and our conditioning, which includes walking, jogging, running, swimming, cycling, and so forth. Resistance exercises are those which are done with weights. They reduce liver inflammation, improve the glucose absorption and insulin sensitivity in our body, and they also improve our metabolic parameters. So, going to the gym, lifting weights, free weights, machine-based weights, all of these come under resistance exercises. And a fatty liver, with a combination of aerobic and resistance exercises both, can easily turn back into a normal liver. So, what are the lifestyle tips to tackle MSLD MASH? Get enough vitamins and minerals, regular medical checkups, enough sleep, small frequent meals, decreasing our sugar intake, and finding an exercise routine that we can do daily and sticking to it. What are the medications that we can use to treat fatty liver? What is the pharmacological approach? So there are some medicines which are already in use. Most commonly amongst them are saroglitazar, which is used in MASH with or without fibrosis in both diabetic and non-diabetic patients for a minimum duration of 1 year. Another molecule is pioglitazone, which is for MASH with or without fibrosis in both diabetic and non-diabetic patients for a minimum duration of 2 years. And vitamin E, which is also for patients with MASH with or without fibrosis in non-diabetic only and pediatric patients with a minimum duration of 2 years. How can we prevent fatty liver from happening? So we limit our intake of saturated fats and trans fats, which basically means that we don't eat a lot of fried food, a lot of junk food, a lot of fast food. All of that needs to come down. We eat a healthy, balanced diet. Limit our consumption of refined carbohydrates. Maintain a healthy weight. Quit smoking. Exercise daily, and limit our intake of alcohol. If some medicines are prescribed, we should stick to them and take them as advised. So this is the platform which tells us that we should, pledge to love your liver. And this is the world's only dedicated digital platform on NAFLD and NASH, which is called NASH 24 by 7. This is a comprehensive digital platform which helps to bring awareness about NAFLD and NASH. Thank you.
Yes, thank you so much, sir, for this wonderful talk. This has enlightened us. So, sir, during your session, we had few questions. So now, with your permission, I
Sure.
would like to hear from your views on this question, sir. So, sir, first question is,
Sure.
how common MASH or MASLD in Indian patients, sir?
So MASH MFLD is fairly common. In a large number of people, it goes undiagnosed because they do not have any symptoms. But most studies say that around 25 to 35% of the Indian population at present has some degree of fatty liver. Some of them are diagnosed, some of them remain undiagnosed.
So, the next question is, can NASH NAFLD be age specific?
Can they be?
Age specific?
Yes. So the earlier thought process was that fatty liver can only happen in elderly people, in very obese people, and that is true to a certain extent. But what we've been seeing recently is that it is not really age specific. Young children, adolescents, pediatric populations, they're all developing fatty liver. It has a lot to do with the kind of diet we have, with the kind of exercise we do, and to a certain degree with the genetics that we have. But yes, although it is more prevalent in those who are above the age of 30 or 40, we are seeing a lot of people who have fatty livers even in the pediatric or adolescent age group. Sorry.
Yes. So, sir, another question we have received is, what is the ideal diet recommendation for MASH patients?
So, like we discussed, the ideal diet is a diet which is hypocaloric. The total calorie content of a diet should be low. We should have a low carbohydrate diet, which means lesser refined products, less of bread, less of potatoes, rice, less of sugar. And we should have more of whole grains, more of vegetables, more of unrefined, unpolished foods. These is this is a generalization, but in most of the cases, we realize that the patients are taking a very high carbohydrate or a very highly refined diet, which leads to fatty liver.
Yes, sir. So, sir, one last question. So, sir, is fatty liver reversible? Is it?
Yes, yes. Simple answer yes. Fatty liver is 100% reversible with diet and exercise. Most people are able to reverse their fatty livers and bring it back to an absolutely normal functioning liver. It is easy to do, does not require too much of work, does not require too many medicines, and should be attempted for everybody who has a fatty liver.
Oh, yes. So, on behalf of NASH 24 by 7, I extend my sincere thanks to Dr. Dhruv for his enlightening and engaging session on MASLD and MASH. So, Sir's insight have highlighted that the critical need for increasing awareness about fatty liver disease and related conditions. So, I also want to express my appreciation to the audience for their active participation and valuable contributions. Your feedback and suggestions are essential as we strive to enhance our future Facebook Live programs and educational initiatives. So please stay connected with Nash 24/7 on Facebook page for updates and information. Remember, your health and health of your loved ones are paramount. So take care, stay well, and thank you so much, sir, for your valuable time. Thank you
Thank you for
once
having me.
again.
Thank you so much.